All right. Can you see my screen? Awesome. All right. So welcome. So first off, some introductions of your clerkship directors. So first off, we have Dr. Hannah Smitherman. She's our pediatrics clerkship director. We have Dr. Whitney Lefevre is our family medicine clerkship director. Excuse me. Dr. John Burberry is our surgery clerkship director. And hot off the press, Dr. Chinmay Patel is going to be joining us as our emergency medicine clerkship director. There's me. And then Dr. Saju Pillay is going to be joining as our internal medicine clerkship director. And Dr. Claudia Perez is our neurology clerkship director. The two most important women in our crew are Kayla Beeler and Emily Barrios. You may recognize their names from emails, but they are the ones that help us to get this mega ship up and running, doing schedules. So you may have seen a lot of emails lately because we are now pushing out our student schedules. Last and most certainly not least is Dr. Jonathan Fisher. He's our big boss, also known as Fish, on the team as well. So we'd like to introduce you to our students. On the left here is our class of 2023. This is the inaugural class for the School of Medicine, also known as the Dorman Scholars. And they are currently on rotation right now. Some of you may have met them already in the hospital setting, doing their inpatient immersions. And they will be coming to an office near you January 4th, 2021. Unfortunately, we don't have a class picture of class of 2024, secondary to COVID. But hopefully we will get one soon. First and foremost, I want to say thank you for joining our team and being preceptors and taking on our students. So first off, I wanted to start off with a video. I'm going to have to flip this back. Hold on just a second. There we go. Of one of our immersions, excuse me, one of our immersions preceptors who was new to the school and gave us some feedback on how things have gone.
Hi, I'd like to welcome everyone, faculty, to Dr. Ijoma Carol Wallaway. She's our medical director at Baylor All Saints in Fort Worth. She's one of our inpatient preceptors there, and I just wanted her to give a few words of what her experience has been with our students.
Well, thanks for having me. We've had a great time with the students. They've come eager to learn, asking a lot of questions, and excited about seeing real patients and not being in the classroom. And we have felt all of that as well. Our docs were pretty excited about teaching and being a part of their education. So we've appreciated that opportunity.
Did you have any difficulties along the way?
Yeah, had some. I actually was brand new to the organization. I started about a month and a half before the students. And so really trying to figure out, what is my role? What are the important things to the organization? How do we interplay with the school? What is the school wanting from us? That was a lot. I asked a lot of questions, so I appreciate your patience, Dr. Pillay, but really wanting to make sure that we were giving the students the opportunity and the experience that they needed.
Okay, great. And would you do this again?
Absolutely. We've learned a lot. We're actually in the process of starting an internal medicine residency program. And so having these students was one of our first experiences with learners. And I think we've learned, like I said, a lot along the way. Initially, all the docs were super excited about teaching and having students. Once they arrived, we had a lot of panic and burnout even, as people felt that they had to teach them everything on day one. And so one of the things that we did here at Baylor All Saints was I took that checklist of the information that you wanted them to learn, or that list of objectives, and I created a checklist of that. And so we used that. Each student received one on day one. It had the objective, it had a date and a place for the hospitalist attending to initial. And that way the student knew what they were supposed to be seeing. The attending knew kind of what their realm was as well, and created interactions, making sure that everyone was on pace and learning what they needed to. So that was really helpful.
Thank you, Dr. Wellaway. We really appreciate your time and look forward. Our students are very grateful for the experience they had with you. So thank you for your comments. Thank you.
No problem. Thank you. Take care.
Bye.
Bye.
So we just wanted to give you a little bit of perspective. Our students currently are in the inpatient setting, and we've had our students at hospitals that haven't traditionally had medical students in the past. And so nursing staff, physicians, and everyone as well was kind of learning as we go along. So first off, one of the biggest things, it is the year of 2020 that we're going to talk about is COVID concerns. So the national guidelines from the AAMC have basically said that students can rotate and participate in patient care. As we all know, the medical school, medical education hamster wheel, so to speak, has to keep turning. We have to have new interns come next July. And so we still want our students in the clinical learning environment to become doctors. As far as the School of Medicine goes, we do not want students working with COVID positive or PUI patients. This, however, does not eliminate patients who may be having a surgery or a procedure and are getting a COVID test but are asymptomatic. They still can participate in the care of those patients. Of course, we know that all patients potentially carry and shed the virus, so PPE is mandatory. Surgical, we've asked our students to wear a surgical mask and eye coverage at the bare minimum. Every institution, clinic, hospital system has different requirements, and so we're trying to make sure that we have understanding of what those requirements are. All of our students are trained in the proper donning and doffing of PPE. And if there's any questions, just let us know. So just to give you a little bit of overview of kind of how our curriculum works. So it's still 4 years of medical school, but we break it up into 3 phases as opposed to the traditional 2-year or 2 years. So in phase 1 is when our students did their traditional kind of basic sciences. They also learned clinical skills, and some of them already got started with some of you in the LIC doing their phase 1 LIC in family medicine or internal medicine clinics. They're also working on a scholarly pursuit and thesis, which is a 4-year-long research project. Next up, which is where we are right now, is phase 2, and this is also known as the clerkship year. So even though our students are second-year medical students, they are clerkship students, and so kind of as a framework to think of that. They did a transition course where we prepped them to moving into the clinical learning environment, do lots of simulation, dealing with difficult situations and scenarios. They currently are on their inpatient immersions, doing 9 weeks of inpatient medicine, pediatrics, OB-GYN, and surgery. And then soon enough, starting January 4th of 2021, they'll be coming to an office or emergency room near you. Beyond that, in phase 3 is their kind of explore and discover time. That's where they do more electives, sub-Is, AIs, critical care rotations, and then ultimately we'll end with the residency boot camp. Within phase 2, LIC, we're doing 8 specialties. Pediatrics, internal medicine, and family medicine and surgery are a half day every week, whereas OB-GYN, psychiatry, and neurology are a half day every other week. Emergency medicine will do 16 shifts over that 14-week time frame. Within the LIC, they're also going to have newborn nursery, births that can include newborn nursery, EMS ride-alongs, community medicine experiences. And then the educational kind of didactic teaching component is what we call LEAPs. And these are our learning application and pondering sessions. These are going to be held every Thursday afternoon, so our students will not be available on Thursday afternoons. This is our education based around symptoms. So for example, our first LEAP is based off of abdominal pain. And so we'll be talking about how a pediatrician approaches abdominal pain versus a surgeon versus an internist. These are very interactive sessions. Some will be on Zoom and some will be in person. So if you're interested in helping and facilitating the sessions, we would love to have you. To give you just kind of an overview, this is kind of a crazy slide, but this is essentially what a schedule would look like for a student. So you'll see they have all their various experiences. There's a psychiatry burst in here. And then you'll also see this white area with supplemental experience written in. And this is a place where students can flex their time. For example, if you have a vacation and you need to flex and have a student come on a different day, if you're out sick, or for surgical specialties like OB and surgery, is if you're scheduling a patient for surgery that the student wants to participate, you can try to coordinate schedules that way. So overall, each clerkship has its own set of objectives based off of its specialty. There's also a list of required experiences for each clerkship that the student must accomplish throughout the whole LIC. So they don't have to accomplish this in their first day. And some of these experiences are actually, they've already gotten when they've been on their inpatient rotation. You'll be getting regular communication from us talking about specifically the LEAP topic for the week. And one of the thoughts is trying to gear your clinical session with the students towards that topic. So if a student is with me in OB-GYN clinic and the topic is abdominal pain, I might try to see if there's a patient on my schedule who has, chronic pelvic pain, and have the student see them so they can kind of make that connection between the clinical scenario as well as the educational experiences. One of our biggest goals with the LIC is that the students have continuity. And so each of our specialties have different requirements for continuity, and those are specialty specific. And so obviously in ER, we hope they don't have continuity, but in OB, they might follow a pregnant patient throughout their pregnancy and come in for their delivery. So a couple of tips for success. First and foremost, I think one of the most important things is setting expectations with a student. So really kind of laying things out that are clear and explicit. So on the first day, obviously there's introductions, but don't just think of introductions for just you and your student, but also your partners, your clinic staff, your front desk staff, so that the student knows who all they're working with. Excuse me. You might also want to give them a tour of the office and show them where they might be working, and talk how your clinic flows. Everybody's got a different office flow, and so how your patients work through the system. Contact information, how you would like your students to contact you. That is totally up to you. And then also expectations for themselves. What do you expect of them, as well as what do they expect of you? From there, within every session, we talk about having an initial huddle. We also sometimes call it the 1-minute preceptor or the 1-minute learner. And it's basically just taking a minute or two at the beginning of the clinic session to huddle with your students and kind of talk about the expectations for the session. You might want to look at your clinic schedule and see if there's certain patients that you'd like your student to see. And then also talking to your student about how you want them to see the patient. Do you want to go see them together? Do you want to go together but have the student do the history taking and you do the documentation? And then also how you want your students to present the patient to you. Every clinic system is different as far as documentation and what a medical student can and cannot do. Even if they cannot document in your electronic medical record, or if you're on paper charts, you don't want them documenting in the paper chart, we do ask that the students practice documentation on a piece of paper or in a Word document so that they get in the habit of learning how to document. And then also, a lot of times students want to know, when can I ask questions? Talking to them about if you're doing a sensitive exam may not be the opportune time to ask questions. And then at the end of the session, doing a little bit of feedback. So talking to the student about what went well, what needs improvement, and suggestions for next time when they come back. And as tempting as it is to just dive right in and get to patients, as we often have very busy schedules, try to set aside just a little bit of time to set expectations. In the long term, it'll pay out dividends in your work together. Schedules. So as you saw, it's a very complex, complicated schedule. Some of you may have been getting emails already from our clerkship team with your students' information. And if you haven't, that information is coming out soon. And so one of the things that comes up is you go on vacation, you're out sick, things happen, life happens, COVID happens. And so what do you do in those circumstances? And so our students are adults, adult learners, and basically we want you guys to work together to try to figure out schedule adjustments. They can also work with, if you're in a group and you have a physician partner who is also TCU and UNTHSC faculty, they can work with one of your partners for that session. As I showed in the schedule earlier, students do have flex time, and so that's an opportunity where they can make up missed sessions. It's also an opportunity for that continuity piece. So if you're seeing a patient that you're referring to a cardiologist, the student might want to go with, if that's one of their continuity patients, might want to go with the patient to the cardiology appointment to kind of see what that process is like. In this day and age, we do have to talk about boundaries. And so as a teacher of medicine, we vow respect, fairness, and mentorship to our students. And just recognizing that we're in a learner-teacher relationship with our students, and just keeping that in the back of our mind when working with students. I'm going to transition over to Paige Quarter. She is one of our assessment gurus, and I will have her take over.
All right, so welcome everybody. Thank you for coming tonight. I'm Paige Quarter. I'm the Director of Assessment for the School of Medicine. So we're going to briefly talk about kind of the philosophy of assessment at the School of Medicine, how this will work in the outpatient setting during Phase 2 LIC, and then importantly, how to actually complete those assessments. We'll look at the program that you're going to be using, and then our contact information if you have any questions later on. So there we go. So throughout our curriculum, students are assessed using exams, which I know you're all familiar with, which are multiple choice exams primarily used to assess knowledge. But what we're asking you to do is to assess our students using competency rubrics to assess their skills and competencies. Regardless of which assessment method is used throughout the School of Medicine, all of our assessments are rooted in our educational program objectives. So those EPOs is how we assess student performance within the School of Medicine's curriculum, the whole span of the curriculum. And then each EPO has a graduated, specifically defined milestone, and they range from does not meet expectations all the way through meets Phase 3 expectations. And then once we have that, we create these specific rubrics with you'll see to create our assessments. By the end of Phase 2, all students are expected to be at the meets Phase 2 expectations on all EPOs. So at the end of their 40 weeks, that's where they are expected to be when they're in working with you in their clinical experience. So how this will work is that every 2 weeks, because like you remember that block earlier, it's like a 2-week rotation of blocks. So if you see your student every other week or you see them every week, it's basically a 2-week section. So every 2 weeks, a new assessment will be sent through my tip report, which we'll go over in a few minutes. Each assessment will have 2 to 3 EPOs and then places for narrative feedback. These do not take very long to fill out. We've been getting pretty positive results from our inpatient preceptors. So this is not designed to be something that is another task that we're asking you to do. It's hopefully something that's pretty seamless with your student already. There will be 4 sets of EPOs that'll rotate throughout the 40 weeks, and they're kind of grouped together, and we'll look at them briefly. Let's go ahead and go to the next one. So the first one is about a physical exam and history. And so you'll see that they gradually get more experienced. And then again, Phase 2 expectations is where we expect our students to be at the end of the phase. The second week will be about elicit and synthesizing diagnostic data, developing accurate differential diagnosis, and then developing evidence-based and patient-centered care plans. And I know we're going through these pretty quickly. This presentation will be sent to you, so there's no need to read it all right now, but it's just to give you an idea of how these assessments are going to look. Now, the third week is a little different, or the third set. So everyone will answer the language row or component, and then everybody but psychiatry will talk about basic psychiatry or basic procedure skills. The psychiatry clerkship participants, we'll only be talking about active listening. So this is one of those that, depending on your specialty area, will depend on which one of these that you're rating your student on, and the other one you'll just answer as not applicable. And again, I'll show you later what that actually looks like. And then the last group of EPOs that we're asking you to rate our students on are about professionalism and their ability to accept responsibility in the moment. These are very important to our curriculum and our beliefs in our school. So like I said, they have the entire phase to achieve expectations. So at the same time, we also want to make sure that you're rating them properly, that you refrain from rating too highly at the beginning so that you're not leaving any room for growth or development of the student, but also not rating them too harshly based off something that you may be expecting them to do that isn't aligned with the EPOs or the assessment rubrics. And so we want to make sure that students are rated accurately on their overall development. So all these students are second to third year medical students. Their developmental stage within phase 2. So how you rate them on week 1 versus week 40 may be slightly different. So just kind of keep that in mind as you rate them over the phase. The expectations of the clerkships. So what we're expecting them to do specific to your area. And then most importantly, those observed behavior skills and knowledge, what you actually see them doing. And so we are collecting these every other week because those point-in-time assessments are really important. They help us record accurate details and ratings in the moment, so we're not trying to remember 2-3 months ago how someone was doing. It allows the students to receive that feedback and apply it in real time so that they can see that feedback from you. They can say, I need to really brush up on this. They can hopefully read or do some little bit of studying before they come see you again. So hopefully you'll start to see that improvement cycle. And it allows students, preceptors, and clerkship directors, again, to see that growth and track their progress over time. So for each assessment, you will have the rubric portion to be filled out, and then you'll also have opportunities to provide narrative feedback. So it should have one that says what should be continued, so what the student is doing well, and what the student can improve on. And a reminder that narrative feedback should always be specific. So it's focused on, again, those observable skills and behaviors. It's constructive, so it's focused on potential actions the student can take. Timely, so like, again, that's the point in time, should be on a regular basis. It's focused on the recent past. And as much as possible, please use complete sentences, not fragments or thoughts. Your comments are very important, but they need to be interpreted by others, clerkship directors, students. And so when possible, please use complete sentences. And then, so what do these assessments impact? Are you filling this out for a reason? And the answer is yes, you are. So student performance is captured by these assessments as part of determining their final phase 2 LIC course grade. These assessments are also used for coaching and learning opportunities with our students. They help the students themselves identify their strengths, passions, and their ultimate specialties. And they're also used by the clerkship directors in the School of Medicine to draft their MSPEs or their dean's letters for residency applications. So there's a lot that's coming out of these assessments that we're using for our students. So how will you do this? You will use mytipreport.com. Credentials should have already come from, I think, the MD clerkship email. If not, they've come from either Kayla or Emily. And my tips can either be done on a laptop or on your phone. I think most of our physicians actually use their phone. They find it really easy to download the app. There, Dr. Combs is holding hers up. They find it really easy to use the app. And then little reminders or push notifications can be enabled in the app so that you know when an assessment has been assigned to you. And then I will show you, so we're gonna go through some screenshots. These are from my laptop, but they're very similar to what you would see on your phone. So you would sign in to My Tip Report using your email address that your credentials were sent to. If you have a TCU email address, it's going to go through our single sign-on authentication. If not, you'll just set your own password. And then when you sign in, you'll see if you have any requests or anything that's been assigned to you. They will be assigned at the beginning of the 2-week period. So let's say that they're assigned on that Monday, but you don't see the students until the following Thursday. You don't have to fill it out until you've seen your student. And so it may be there, it may sit there for a week or so, but we want that to be there so that you can see what you're supposed to be rating them on. Then you can watch, you can have your encounter with them, and then you can rate the student. So on this example, I had 4 students assigned to me. And so that was easily that I can see there. Then I click on one of the students, I select my specialty, and then keep going. What's most important about here is that there is the option to decline the request. Please do not do this. If you don't interact with your student during that 2 weeks for whatever reason, let us know and we will reassign it. But just please don't click that decline request. So once you check your specialty, you'll scroll down and then you'll see the 2 EPOs that you'll be rating your students on. So this one is physical exam and history. And when you hover over the rating, you'll see a definition of that milestone. So what we're looking for. And then you click the box, the corresponding box to assess the student. So that'll pop up and then you just click the box that is assessed. You will notice here that it does say NA. So for whatever reason, during that time period with the student, you didn't see them perform a history or a physical exam, you can check that box as appropriate. Then you can scroll down from there, and here are 3 areas for narrative feedback. So there's going to be that one area for what the student should continue, what they should improve upon. And then you'll also have an area to talk about any other observations about the student. So for this week, if it was about physical exam and history, but you saw them do something else that was really amazing outside of that, let us know about it. Furthermore, if you have any concerns or anything like that, this is a great place to let us know that. Another really great thing about My Tips is that you can do the text to talk function, so that you should be able to just talk right into your phone and it'll record that in those boxes, so that you can kind of double up on your, when you're talking to your student, you can kind of use that as a time to collect your thoughts and talk right into your phone. Most importantly, please click submit when you're finished. Otherwise, it's like doing your homework and throwing it in the trash. We want to make sure that that hard work is captured. And then, like I said, on that third one, there's going to be that communication and procedure. It's going to be a little different. So everyone is going to check the language. You're going to check the language box. But on this one, I pretended that I was a psychiatrist. So I didn't have the basic procedural skills. I did the active listening is what I rated on them. And there are a couple. So you answer NA to the APO that is not relevant for you. I'm going to address these questions that have popped up really quickly. The app may never ask you to set a password. That may be because of how you're entering your credentials from your email. If it's working for you, keep going. Sounds great. The students will be able to see and read your comments. So just make sure to keep that in mind. Not that we don't want to tell them how they can't improve or what they're doing well, but yes, the students will be able to see your comments. And when your assessment is submitted, you'll see a little green check mark. You will see names here on the leaderboards. That is how many assessments you have completed, not who has the most amazing students. But it can just be a way for you and your peers to have a little friendly competition of who's doing their assessments and on time. And then whenever you're done, you can just click out of that. And then if you ever need to see a previous request or assessment, when your requests are empty, it'll say there's nothing here for you, but you can always filter by active, completed, declined, or expired. So you can see other ones. You can also click on, go to the next one. Yep, on feedback sent, you can click there and you can see how you've rated your students. So if you need to look back for any reason to a previous assessment, or if a student's asked you for a letter of recommendation or something like that, you can always refer back to anything that you've sent in. If you need to edit something or update it, say you complete it, you're one of those specialties that you see students every week, but they're in 2-week periods. And so on this Monday, they did this, and the next Monday, you want to edit your assessment. You can do that. You can open up that assessment, like you said, on the feedback sent and open it up. And you can just click update and then update it as needed. Just be very careful if you're doing that and it's not within like a 2 to 3 week window of when you initially did it. So if you go back months later, what's happened is we've probably already pulled that data and we're not capturing any update that you've submitted. So if that's the issue, please contact MD Clerkship at TCU and we'll make sure that we have the correct data pulled. And then the next slide. If you don't mean to click update, you just you exit out of the top. Sometimes we get clicking on our phones and we hit the wrong thing. You should be able just to go back a screen. It's pretty easy to do that. It's pretty easy to navigate. There is an option there that says, do you want to delete this assessment? Please do not do this. Luckily, My Tips will confirm, are you sure you want to do this? And you can always hit cancel. If you accidentally delete something, please contact us and let us know. And then because we will need to reassign that assessment to you for completion. So again, the timing, assessments should be completed at the end of every 2 weeks. So we assign them on the Monday of that 2-week block, and then the reminders will be sent. So that reminder will appear when the assessment becomes available. They are really short. They're 2 to 3 EPOs at a time. The whole process doesn't take more than 3 to 5 minutes. 325, not 35. Sorry, I didn't say that very clearly. And if your schedule changes or you didn't supervise a student, let us know so that we can reassign that assessment. And then just a big thank you. We know that this is another thing we're asking you to do, is to assess our students, but in addition to allowing them in your practice, but we really appreciate it, and that this experience and this feedback is a valuable part of their educational training. So we thank you so much for being compliant with that as well. Here is the contact information. I saw that comment in the chat. If you have questions for our LIC coordinators, you can reach out to MD Clerkship or our assessment team at mdassessment@tcu.edu. The LIC course coordinators and our assessment team work hand in hand. So somehow we will take care of any issue that you may have. I think that is it. So I will turn it back over to Dr. Combs.
If I could give Starbucks points, I would. So just to kind of echo what Paige was saying, you know, for students and learners, is the only way for them to get better is for us to tell them when they're doing great and they did something awesome, but also when they didn't do something awesome and they need to improve upon that. And so what's really nice with my tip is, yes, it's on, there is an app for that, and I find it very easy to use. And just like I was talking about setting expectations at the end of the clinic session, when you're talking to the student about how they're doing, you can also use that opportunity to input that information while you're talking to the student. As she said, you can also dictate. So if you're telling the student, I'm going to give you some feedback, and you can dictate at the same time. So it's going into my tip and then just edit it if you need to. So really, we're trying to make it as easy as possible. And this way, you won't have to do at the end of 40 weeks a big comprehensive evaluation, is because we will have all these pieces along the way that we will be able to pull in an evaluation based off of the data along the way. So just some formal housekeeping. So some of you, if you've gotten access to my tip report already, you may have already gotten a request to evaluate, and it's basically saying that you've received the LIC syllabus and School of Medicine faculty handbook. It has all the lovely policies that we have to have and make sure you are aware of. They're available on the School of Medicine website. And so the My Tip report request for that was just to get you familiar with the app. So what do you do if problems come up? So we ask that you contact your respective clerkship director to the point of somebody asking, you know, can your students see these evaluations and assessments? So they can. So if there's something that you want to talk, that you want to address directly with the clerkship director and that you don't necessarily want to put in the assessment, then reach out to us. This is our cell numbers as well as our email addresses. On the flip side of that, if there's something that you have concern about, we also want to empower you as educators. Is you're teaching the student, you are seeing the behavior or action that you may be concerned about. And so really trying to address that in real time with the student. Or if there's something that you're not sure about, maybe talking with your respective clerkship director and then getting back to them, getting back to the student directly. Sometimes it's a challenge. We don't necessarily want to be the bad guy with students if they're doing something wrong, but I think it's really important as an educator to bring that to our students' attention. And then I don't have Dr. Patel's information on here. Like I said, it's hot off the press coming in as our emergency medicine clerkship director, but we'll get that to you when we have it. Yes, so each of us, so after this presentation, you will all get a copy of this presentation that has all the information in it, and it's got all of our contact information in it as well. And then in addition, as we move forward, we'll be, like I said, we'll be in regular communication so for me, I'll be reaching out to all the OB-GYN preceptors and keeping those lines of communication open. And we're always available to ask any questions. And with that, I will turn it over. I've tried to answer the questions from the chat, but if anyone else has any lingering questions, concerns, worries, thoughts that they'd like to share, now is your chance.
This is Asher, ma'am. I'm a neurology preceptor. Can you all hear me?
Yes.
I'm playing with this application. I don't see my specialty here.
Is it specialty specific yet, Paige?
On that,
It may not be if it's still in immersions.
if you're
Okay.
looking at if you're looking at the attestation to fill out your like when you click on that one, it should have neurology listed. If you're looking at one of the other ones, it's because our inpatient neurology isn't part of that. So it's just internal medicine, OB-GYN, peds, and surgery. So it could be what
did
you're
you say
looking at.
attestation?
Yeah, that's the one we need everybody to fill out to say that they've seen the syllabus. So if you click on that one, you should be able to complete it.
Okay.
And then a question about going to different hospitals. So within getting our students onboarded with you, one of the questions we had is what facilities you go to, so that ideally we can get our students credentialed and able to go into those facilities. If you have more specific questions, just reach out to us and we can make sure that we have all that covered. Somebody wanted to know about objectives for specific specialty. As Dr. Fisher, are we emailing those out?
So if you click on the attestation in my tip report, it'll be it'll be there. But we're also going to send them out as we get closer. We'll send you that part of the syllabus.
So the syllabus itself encompasses the LIC as well as all 8 specialties. And so we're going to send out, so you have access to that big syllabus, which is a very large document. And so we're going to shorten it and just give you the pieces for your specialty as we get closer to when students are coming to your clinics. And then
Another question, will we have more than one student?
so depending on the specialty, some we have had to request for some preceptors to take more than one student, but usually that's been an ask before a second student is assigned to you. So unless you've been asked, you should only be expecting one student.
And then the next one was, are the students bringing their own PPE and are we providing that? Or are they providing that?
Dr. Fisher?
It depends on what your facility's needs are and where you work. So generally we just send the students without PPE, but if that's something that's a requirement of your site, please contact me directly or MD Clerkship and we can work out those details of what needs to be provided.
Okay, the next question was about vacation planning on the 2nd week of January. So do I just work out this with the student or should I let someone know?
I say work it out with the student. So like I said, schedules will be coming out, or sorry, not schedules, but student assignments should be coming out this week. So within that, you'll also have the contact information for the student. And so touching base with them. If you want to, this can also be something that if they're there that first week of January with you at that time, you can talk about it and try to find another time that they can work with you.
So here's one, Shana, about the multiple physicians and we have multiple physicians and APPs and often consult each other on usual cases. No one is on faculty. So how does that work with the students? Can they see other, can they see cases, unusual presentations with them?
I would say if it's an exceptional learning opportunity, yes.
I think the main goal is for the student to be in clinic assigned with their preceptor. But if there's something else that's going on in the clinic, for example, in neurology, you know, there's a really good EEG or an EMG and you want to show them and somebody else is doing diagnostic testing, then the student can walk over and look. I think the main goal is just to have that continuity in clinic with the same preceptor on their visits. But within that day, they may see different patients. As long
Right. I'm sorry. I'm in pediatrics. And so
Okay.
kids come in with weird stuff all the time. And since there are 7 of us, you know, I'm not going to see all of the things that everyone will see. So that's why I'm asking, because it's 15-minute visits, 10-minute visits, pretty much going quickly.
Yeah, if you want to send them over to see a specific case, they can, and then they would just come back to you.
As long
Okay,
as
thanks.
they're staying under your general supervision, right? Because they're your student. But yes, please let them take up all the learning opportunities you can provide.
There was another question.
Oh, so there is one about what to do if we don't think a student will be able to fulfill an objective with our patient population.
So one of our main objectives with the students is they do actually, for the required experiences, have to track along the way what those patients, they have to do that tracking, logging that a lot of us had to do in residency. So they have to do that as well. And so throughout the 40 weeks, if there's times where they don't have and they haven't had exposure to one of those experiences in conversation with us as well as with you, hey, I haven't seen this. Is there another way that I can see this? And then, so between the three of us, we can figure that out. Also, for the required experiences, we do have alternative, a lot of them are like online modules for students to do as well.
And and I would add to that, if you guys see the actual EPO ratings that we're grading them, they're very generally broad. So it's more about, can they perform a history, physical exam, so that they should be able to accomplish. And then the specifics, like Dr. Combs said.
Dr. Fisher, a question about covered, protected from medical legal risk.
Can you elaborate more about the concern around medical legal risk that students have their own malpractice insurance and coverage and such? That should be there and in place, but not a problem. There's never, if you go through LexisNexis, there's never really been a significant case involving a medical student as part of a lawsuit that would sort of worry people. It's always this theoretical risk, but it's, in the practice, it's not out there. Did that answer the question, or is there more concern to it?
I guess the follow-up to that is, should I inform my liability insurance?
Most people, I've never seen that as a coverage option, but I think that's something you'll have to check with your individual carriers.
And I see a question here from Dr. Benzali, who is one of our surgeons, neurosurgeons. So yeah, so you submitted your clinic days, and you're just asking if you're in surgery the day that the student's supposed to be there. The student should be credentialed within your hospital. So if the day that you guys were supposed to be in clinic, you're operating or you're on call, the student can come and meet you in the operating room if you feel that that is appropriate. They can observe, and they are gradually have progressive skills in their surgical specialties also. So as far as how much interaction they have within the OR, that would be up to you and kind of how you feel. But they can definitely go with you to the other environments. If it's not opportune for the student and you have a partner who maybe has clinic that day, if you feel that that's more appropriate, then maybe they can see patients that afternoon with your partner. So it really is up to you.
Yeah, and
if I could elaborate on my question just a little bit, because I did not submit like any of my usual surgery days, does that mean that the student, like, is there more flexibility available, to kind of say like, okay, I've got an interesting case today, why don't we go, come with me and see this case?
That's exactly what the flex time is there for.
Okay.
If you saw that white space, is for them to be able to have those experiences. And if there's, and especially if it's somebody that you see in clinic and you think, hey, it'd be really good if you were in on the surgery to follow up. So then they have those white spaces where they can move over and hopefully join you in some of those.
That's the L of the longitudinal, right? The LIC. And that's what we would love to be able to happen And other examples would be if Dr. Combs' patients deliver and then the pediatricians, see them and follow up, or, somehow getting the continuity between patients is really kind of the fun part of it. Sorry, Dr. Fisher, I didn't mean to interrupt you.
No, you're fine. So I just want to emphasize, right? The goal is to be with their preceptor, not in their preceptor's office, right? So if you are an OB and you go to the L&D floor, or you go to the OR, or you are a surgeon, you go to the OR, or a psychiatrist, and you go around, as long as the student has credentials at the facility, we want them to go with you and be part of that experience, right? The goal will be to get them to have all these experiences that the practicing physician would have in their specialty.
Yeah, and there's a question specifically about hospital requirements. So again, when we were asking you about what clinic days, along with that, we were asking which hospitals you work with, so that in the background, our students are getting credentialed. If you're not sure, if you let us know that information, which hospitals you go to, you can send that along to MD Clerkship, and we can work on processes to get our students credentialed. So as far as seeing a specialist, so there's two ways for the student to do this. Is if they're going to go see a specialist and that specialist happens to be part of the faculty, then they can participate as far as as a healthcare provider. So with the, if it's a cardiologist, they can come in with a cardiologist and see it from that setting. If, however, the specialist is not part of the faculty, they're going with the students to, they're going with the patients, more so as a patient advocate, but also just to kind of see what that process is like of seeing a specialist. And so, of course, that has to be with the patient's permission. As we go through this process, we're not going to hit everything tonight, but one of the things we'll talk about is panel patients, and how a student's going to follow a patient into other environments. So for the most part, most of the hospitals in the area are aware of the students. We have multiple agreements with a lot of hospitals, surgery centers, and such across the Metroplex. And so as far as permission to be in the operating room specifically, it's just making sure that the student is credentialed at that site. So if you work at possibly a smaller surgery center or a smaller hospital and you're not sure if we have a relationship with them, again, just let us know at MD Clerkship which hospitals you work with, so that we can try to get our students credentialed at those sites.
And I guess just to follow up a little bit on the question that just popped up, Shanna, about when are the patients in the hospital, when the patients are in the hospital, how are the students made aware? So that really comes back to a little bit of the student-driven learning, where the students will have patient panels where their patients may actually call them and tell them that they are going to be admitted to the hospital. If they're going for an operation, and the student will have to figure out if it's the surgeon that they are working with, then the surgeon would give them permission, or they would discuss that with the patient. If it's one of their patient panel patients, then the student is already following that patient across the different areas of care. And so we'll get more into those specifics once the students are in the clinic. They'll talk a little bit about their patient panels with you. Who are they following? And then you guys may decide that there's a really important case that you'd like the student to see. So then that would be arranged more through the office.
Other questions or concerns? I know this was like rapid fire. So just so you know, we will be sending out the presentation to you all. And like I said, we'll be having regular contacts Before you know it, you'll be like, no more emails, please. In addition, the School of Medicine does have a faculty development site, and we recorded this session, not today's session, but yesterday's session. And so it'll be up on the faculty development site soon enough. There's also lots of good resources on there about orienting your student to the office, how to assess a student, talking about the 1 minute learner, 1 minute preceptor, huddle, all those different things that are available. And if there's more information that you want, if you're not sure about something, if you have questions, please feel free to reach out to any of us. We are happy to answer any and all questions. We know this is new, and we know that we couldn't do this without you. So again, have to say thank you for joining us and bringing our students into your practice. All right. Well, hearing no further questions, I will let you guys have 7 more minutes of your evening back to do what all you need. And again, thank you.
Thank you, everyone.
Thank you.
Mm.